Good afternoon, my dear grade 10 students. So this time we are going to talk about endocrine system. So if you are going to recall our previous lesson, we talk about reproductive system and female reproduction cycle. Okay, so for our objectives, we give the function of the endocrine system. Name the endocrine glands and state their location, the hormone they secrete, the action of the hormones, and the diseases brought about by their deficiencies. And correlate the action of the endocrine system with those of other body systems. Okay, so to start with, let's have first a quick quiz on the different glands of the endocrine system. So try to recall the different glands and label this diagram. So I'm giving you 1 minute, 30 seconds to do this. Okay, are you done? So let's check if you were able to label this correctly. Okay, so starting with the brain, you will see here the 3 glands. We have the pineal, hypothalamus, and pituitary. And then on the neck, we see here thyroid and parathyroid. And then below that, you'll find the one at the back of the breastbone, which is the thymus. And then the one on top of the kidney, we have adrenals. And then we have also pancreas. For female, we have ovary. And for male, we have testes. So these are the glands of the endocrine system. Okay, so speaking of glands, endocrine system is actually a collection of glands. And these glands, of course, produce hormones that regulate metabolism, growth and development, tissue function, sexual function, reproduction, sleep, mood, among other things. So this is a collection of glands, and take note, these glands produces these hormones. What are these hormones? So from the word endo, which means within, and crinis, meaning to secrete. So it's all about secretion within. And what do they secrete? They secrete chemical messengers. Take note, hormones are chemical messengers, which is of course delivered into the bloodstream to be brought to the different tissues or cells, a specific tissue or a specific cell. So again, endocrine system is a collection of glands, and these glands are responsible for the production of hormones. So there are important concepts that we need to understand about hormones. First, some glands do not function until the organism reaches a certain age. Okay, so what they mean by this? So I'm giving you an example. Say for example, the ovary and the testes will only produce this estrogen, progesterone, and testosterone as a person reach the puberty stage. So when they are young, these hormones will not function at all. So only when a person reach puberty, that's the time that it will become functional. second, there's a difference between a short-term and long-term hormones. Okay, so can you give an example of short-term hormone? Okay, good. So that's adrenaline. So adrenaline is an emergency hormone. So it only works, or most of the time it works during emergencies. And the rest is a long-term hormone. The production of each hormone must be the correct amount. So take note of that. The hormone must be in correct amount. Why? Because oversecretion or undersecretion of these hormones will create imbalance in the body. Hormones work only on their target cells or organs. So that's what is nice about hormones. They are very specific with their target cells or organs. And hormones are destroyed in the liver after they have performed their function. So our liver is so important in a way that is the one that destroys the hormone after the hormones perform its function. Okay, so speaking of how hormones work, so it's emphasized that it's very specific on its target cell. So if you are to look at the diagram, you will see that hormones are very specific. So here in this diagram, you will see the target cell. It has a receptor which receives the hormones and perform its function. How hormones work is similar to how lock and key works. So a padlock, a lock, will only open with the right key. So if there are lots of keys and it will not match with the lock, it will not open. So that is so analogous with how hormones work. Okay? Similar also to how letters are sent through mail. So in sending letters, you will specify the exact address. So that is where the letter will go. It will not move into other address because the address is very specific. So that is also compared to how hormones work. So take note, hormones are very specific about its target cell. So since endocrine glands is a collection of glands and this gland secretes hormones, what do you think are the overall role of the endocrine system? Okay, so let's check first. So it regulates the daily activities of the body and control its overall development. Okay, because these hormones work on a lot of things like growth, reproduction, sleep, mood, and many others. So we see that they regulate the daily activities of the body, and it's responsible for the overall development of the body. Another, the endocrine system is also known as the system of checks and balances. Why? Take note, a while ago, it was mentioned that the hormones must be in correct amount. So the glands which secretes hormones, of course, will automatically checks and balances to maintain homeostasis or to keep our body system healthy. Another, it's like a thermostat or a temperature regulator wherein it may turn on when the temperature is below normal and may turn off when the temperature is above normal. So the endocrine system turns on and off in response to the level of hormones in the body. Okay, so say for example, your blood sugar is high. So the pancreas will secrete insulin to lower its amount or to decrease its amount. If your sugar is very low, the glucose, and then the liver, of course, will convert this glucagon to increase the sugar level in your blood. So again, it automatically turns on and off to again have a balance in the presence of this hormone. And of course, when the endocrine system is not performing its job, so it may affect our body like energy level, physical appearance, ability to reproduce, and a lot more. So it is very important that our endocrine system is performing its job well to maintain homeostasis. So in your textbook, you will find the comprehensive discussion of the different glands together with the list of hormones that they secrete and the overall function of these hormones. Okay, so let's discuss one by one the glands of the endocrine and the hormones that they secrete together with their function. So first we have the hypothalamus. Okay, so it's the one that controls the pituitary gland. Actually, pituitary gland is known as the master gland. Why? Because it produces so many hormones. But when they learn that the pituitary is controlled by the hypothalamus, the use of master gland is abolished. Okay, so it's not right to make use of the term master gland because it's controlled by the hypothalamus. Hypothalamus also regulate the function of the endocrine. Same as with the pituitary glands. Okay, and then we have the pineal. It's also in the brain. It's important for your sleep-wake cycle. For the one in the neck, we have the thyroid located in front of your neck, and it's important for metabolism. Parathyroid, on the other hand, is also found in your neck, but its function is to maintain control of the calcium level of your bones and blood. For thymus, it's located in the upper torso or at the back of your breastbone, is active until puberty. And this is important in the development of a type of white blood cells. We call it as T cell. Actually, when you were young, the thymus is so big because it's the one that produces the defense mechanism needed by the baby. And as you enter puberty, the size almost is the size of the thumb, so small because its function is performed by other endocrine glands. So it becomes smaller as a person enters puberty. Adrenal is found on top of the kidney, and its function is to regulate blood pressure, heart rate, and stress response. And we have also pancreas located in your abdomen or behind your stomach. So it's important in controlling blood sugar levels. Okay, so these are the glands of the endocrine system. So let's check the hormones that they secrete. So you'll find here for adrenal, the one found on top of the kidney secretes adrenaline, aldosterone, cortisol, and DHEA. And again, for adrenaline, it's important to reaction to stress, increased blood pressure, heart rate, and metabolism. Aldosterone is for controlling body salt and water. Cortisol play an important role also in stress response, and DHEA is important for growth of body hair during puberty. So there are 4 hormones secreted by the adrenal gland. Actually, human has this 40 hormones. And these hormones, of course, are important for the overall growth and development. So for ovary, we already know this because we had this in the reproductive system. So it's important for the menstrual cycle. So we also have pituitary gland. So why it's called a master gland? Because you see there are so many hormones that it secretes. We have the follicle stimulating hormone and luteinizing hormone, which we learn from the reproductive. No, it also plays an important role in the reproduction cycle. So we have for melatonin for the controls sleep and wake cycle. Oxytocin is very important in labor. So during labor, the pituitary secretes a lot of oxytocin because it is needed at that time, right? So for pancreas, we see it secretes 2 hormones, glucagon and insulin. So for increasing levels of blood glucose, it's glucagon. And to reduce blood glucose level, it's insulin. That's why if you have a blood glucose level which is high, your pancreas secretes a lot of insulin to lower or to reduce that glucose level. But if your blood glucose level is so low, then it will secrete glucagon to increase that blood glucose. Okay? And then we also have for parathyroid, it secretes parathormone, important for controlling calcium levels in bones and blood. And then we have also here for ovary and the testes, we have that in reproductive, we have progesterone and testosterone. Okay, that's why you can check here that there is really a coordinated function between endocrine and reproductive, and also for nervous, because the pineal, hypothalamus, and pituitary are part of the brain, and brain is part of the nervous system. So with the inclusion of progesterone, testosterone, so we now understand that endocrine is really related to, or has a relation with the reproductive system. Okay. Then we have also for thyroid, we have the thyroid hormone responsible for metabolism. Okay, so you know what metabolism is. Okay, so metabolism is a chemical reaction wherein the food taken is burned and converted into fuel, which gives energy to the body. So that's metabolism. Okay, so that's the list of hormones secreted in the different glands of the endocrine system. So we now understand the function of each. That's why we can possibly think of the diseases related to in case that there is a deficiency or there is an oversecretion of these hormones. No, how will it end up in the different diseases of the endocrine? And speaking of diseases, so when a gland, the diseases of the endocrine system only happen when a gland produces too much or too little oversecretion or undersecretion of these hormones. So we call it as hormone imbalance. So this is brought about by the development of lesions such as nodules or tumors in the endocrine system, which may or may not affect hormone level. So the increase or decrease, oversecretion or undersecretion, or having this hormone imbalance are caused by first disease. Second is failure of a gland to stimulate another gland to release that hormone. Say, for example, in the reproductive that we learn, if hypothalamus fails to dictate the pituitary gland to stimulate follicle stimulating and luteinizing hormones, then there will be problems with reproduction cycle. A genetic disorder, infection, injury to an endocrine gland, tumor of an endocrine gland. So again, the hormone imbalance are caused by the following. So what are the examples of the diseases of the endocrine? Can you possibly think of the examples of the endocrine diseases of the endocrine system? Okay, so first is dwarfism. So you know what dwarfism is. So dwarfism results from undersecretion of growth hormones. And opposite of this, of course, gigantism, oversecretion of growth hormones. We also have in the thyroid disorders, we will have hypothyroidism and hyperthyroidism. So hypothyroidism, again, is undersecretion of the thyroid hormone, and hyperthyroidism, oversecretion of the thyroid hormone. And with that, we can possibly experience Graves' disease and goiter. So you know what goiter is. So it's all about iodine deficiency. And also we have estrogen deficiency and testosterone deficiency. Okay, so these are some. There are so many examples of diseases, but I consider these examples. But of course, we have to focus on one of the major killer diseases in the country, which is also a disease of the endocrine, the diabetes mellitus. So this is commonly known as diabetes. It's a group of metabolic disease in which there are high blood sugar levels over a prolonged period. So symptoms of a diabetic person includes frequent urination, increased thirst, and increased hunger. So please take note of that. So if you are experiencing these symptoms, you need to seek medical attention at once. And then pancreas not producing enough insulin, or the cells of the body not responding properly to insulin produced. So take note a while ago that pancreas is the one producing the insulin. Okay, so if there's problem with the production of insulin, or the body is not responding properly to insulin produced, then it will also result to diabetes mellitus. Okay, so for other signs and symptoms, we have blurry vision, headache, fatigue, slow healing of cuts, and itchy skin. Okay, so why do you think a person who is diabetic experience this slow healing of cuts? Okay, so because the area which has cut, because there is high blood glucose or sugar levels in the blood has a hard time to reach the parts with cuts or with wounds. Therefore, the healing is so slow. There's it's a hard time. There's a hard time for the blood when it circulates to reach the area with cuts, and therefore a diabetic person experience that slow healing of cuts. Prolonged high blood glucose can cause glucose absorption in the lens of the eye, which leads to changes in its shape, resulting in vision changes. Okay, so for most of the diabetic patient, there is a problem with their vision. So this is the reason why they experience that. So a number of skin rashes is also experienced, and we call it as diabetic dermatomes. So you also check the skin, you see that there are lots of rashes. So if this disease is left untreated, it may cause many complications. Serious long-term complications include cardiovascular disease, stroke, chronic kidney failure, foot ulcers, and damage to the eye. So as early as the diagnosis, it's important that it is treated, or else it will result to too many complications, which of course these complications may lead to death of that person. So there are actually three types of diabetes mellitus. So the first one, type 1 diabetes mellitus, result from the pancreas failure to produce enough insulin. Type 2 begins with insulin resistance, a condition in which cells fails to respond to insulin properly. And the cause of that is excessive body weight and not enough exercise. And the third is gestational diabetes, occurs when pregnant women without a previous history of diabetes develop a high blood sugar level. So this is for pregnant women. So how are these three types treated? So the first one is healthy diet, physical exercise, maintaining a normal body weight, and avoiding use of tobacco. So if you are to examine, it will always, it's a must that we have a healthy diet. Of course, we have to have physical exercise. So considering that in this time of pandemic, our movement is too limited, and we can't find the right time to have this exercise. That's why we have to deviate from that norm, from that practice. Maintaining a normal body weight. So for obese and for overweight, you have to remember this. And of course, avoid use of tobacco. Type 1 must be managed with insulin injection. So I understand you most of the time observe this, now for those whose family members are diabetic, or your neighbors, or somebody from the community, you've heard about these insulin injections. Okay, so if the sugar is getting higher, and then they resort to insulin injections. And then we have for type 2, may be treated with medications with or without insulin. But again, take note of the weight. So weight loss surgery is advised. And for the gestational, it is usually treated after the birth of the baby. Okay, so because of the problems with diabetes in the country, so this is the latest about the status of diabetes in the country. So diabetes on the rise is the article. So in this article, it's very clear that Philippines is not excluded as far as the number of diabetes cases are concerned, because we rank fifth. And if nothing is done to stem this alarming trend, then it is expected that it will soar to 20% by the year 2045, meaning 100,000 Filipinos would be dying every year due to its complication. So it's too alarming. Though our focus at this point is to combat problems on COVID-19, still it's a must that this needs to be given an utmost attention, or else it's worst compared to what we're experiencing right now. Now, take note of this, 100,000 Filipinos would be dying yearly due to its complication. And with that, you are expected to, in order for you to be able to address the problems, you are to make a blog on diabetes management intended for teenagers like you. And these are the criteria that need to be followed. Content quality 10, video quality 5, and sound quality 5. So the detail will be posted in the Google Classroom. So how are we going to keep the endocrine system healthy? What do you think are the ways of keeping the endocrine system healthy? First, you have to know your family's history. So why it's a must that we have to know our family history? Okay, so in order for you to be able to have the idea of what is exactly the health history of the family, so that you can change your lifestyle for avoiding the diseases that runs in the family. Okay, so you may deviate from whatever lifestyle that they have and try to decide on a healthy lifestyle. Of course, you have to eat a healthy diet. So eat a healthy, balanced diet, okay, together with the exercise. Minimize stress in your life, okay, because stress, of course, affects hormone production. That's why it's a must that we have to minimize stress. Though the kind of life that we have, specifically in your studies, is so stressful, it's still important that we possibly manage them. You find a way on how to manage your stress. And of course, you have to stay in touch with your doctor. So if you feel that there is a problem, with your body, then it's a must to consult and see your doctor. Okay, so that ends our discussion about endocrine system. I hope you get something from this lecture. So thank you so much. See you again next time.